everyone. Thank you for joining us today. Today we're here with Becca Reisforf and Kalkidan Lakew from Women in Global Health. They're both policy associates who are working directly on our policy priorities for the WHO Executive Board, which is happening next week. And today we're going to be talking about what we're going to be looking out for and what are our main priorities during the Executive Board. So first, I'm going to be asking some questions to Becca, who is dedicated to working on pandemic preparedness and response and on healthcare workforce issues for women in global health. So Becca, what are the policy areas that Women in Global Health is watching out for at the Executive Board? Tell me about some of the key priorities for this year's meeting.
Hi, Anna. Lovely to be here. So this year, what we're really watching is three main topic areas that are on the agenda of the Executive Board meeting, which is universal health coverage, pandemic preparedness and response, and the prevention of sexual exploitation, abuse, and harassment. And these are really important topics for women in global health. They have been for a number of years, but especially this year, they're important because the high-level meetings that are happening in September on universal health coverage and pandemic preparedness or response will be very key. And so we really want to see what member states at the World Health Organization's Executive Board meeting are going to be saying about these topics.
Perfect. We know that every year Women in Global Health does a count of the women who are being represented at the Executive Board level. So what is the representation of women this year at the Executive Board? And are we positive about the upward trend or are we not? And what was the trend like on past years?
So the Executive Board consists of 34 representatives from member states. And this year, it's actually 21% of women on the Executive Board. During the pandemic, this number dropped quite drastically. So in 2020, just before the pandemic, we were at 21%. But then last year, so in 2021, January 2021, we reached a low of 6%. So actually only two women on the Executive Board were women, two people on the Executive Board were women. And this was a 10-year low. So this was quite shocking. And we actually published a number of articles on this, really calling this out. But it's hopeful to see that the numbers are rising again. We've kind of gone back to pre-pandemic numbers, but we are still hoping that they will rise. And we really will be calling on the WHO and also member states to include women in senior decision-making roles because this is what's most intelligent for global health.
That sounds really important. What's the impact of the lack of representation of women? So why is this issue so important?
Yeah, this is a really important issue because this is a number that we always say at Women in Global Health, and I'm sure that people watching this have probably heard it before, but women make up 70% of the health and care workforce and 90% of patient-facing roles. And during the pandemic and before, they've been applauded for their contributions that they've made, to the front lines, delivering care during, especially the early months of the pandemic. They're the experts in the communities that they serve. They're nurses, they're midwives, community health workers, and they're often the first point of contact for patients. So they play a really important role in health systems. And the firsthand experience that they have means that when they're in leadership positions, the decisions that they make in terms of, setting the public health agenda means that they'll be prioritizing issues like sexual and reproductive health services, designing personal protective equipment so that it's fitting for women health and care workers. And so having these women in these spaces means that we are, making more intelligent global health decisions. And sidelining women means that there's actually a loss of this expertise in decision making. And this means that it can actually negatively impact the health of populations because we've seen that women have implemented more strategic and effective COVID-19 responses that are oftentimes also more evidence-based. So in conclusion, it's very important to have women in these decision-making roles. We've seen a number of studies come out during the pandemic that have shown that this can be beneficial for global health and especially global health decision-making.
Well, from your response, it seems obvious that a sector-wide change is needed. So what are the steps that are needed for this to happen?
So some of the things that we've been advocating for is really working at the national and regional level. So national policies that mandate quotas, for example, tend to be quite effective, making sure that women are put into these decision-making roles. It's important that countries step up and nominate women to sit on the WHO executive board. This is something that member states can do, and it's important that they do that. But not just the executive board, also other international bodies like the Intergovernmental Negotiating Body that's currently discussing the pandemic instrument and other processes as well. So it's very important that member states are aware of this and are making active decisions to include these women in decision-making roles. But there's also things that go further, such as providing gender-responsive policies, for example, childcare for women who are in senior decision-making roles, so that they're able to take on these roles, and making sure also to close the gender pay gap. So these are just some examples of how this can be achieved.
Well, definitely something to keep an eye out this year. And now I'm going to turn to Dr. Kalkidan. She works in policy in Women in Global Health, and she's dedicated primarily to sexual exploitation, abuse, and harassment, and universal health coverage. So first, let's talk a little bit about sexual exploitation, abuse, and harassment in health. Women in Global Health recently published its Health 2 report related to this topic. And so what is the impact of this abuse on health workers, and how is this related to the executive board? Is this a topic that's going to be taken care of this year?
Sexual exploitation, abuse, and harassment among female health workers has an impact on their physical and mental health. It also hinders their career development and also in the long term contributes towards the great resignation of healthcare workers. And it will also further widen the leadership gap that we witness in the sector. Earlier, it was mentioned by my colleague Becca about the percentage of women representing representing on the leadership positions and decision-making roles. And additionally, sexual exploitation, abuse, and harassment among health workers compromise the quality of care provided to clients and affect the overall health services. Unless sexual exploitation, abuse, and harassment is addressed proactively, it will carry a healthcare and societal costs. So ensuring a safe work environment should be the bare minimum work of health institutions. And during the EB, what we'll be asking on this topic is, we want member states to warrant safe work environment for their health workers, and including eliminating sexual exploitation, abuse, and harassment. Additionally, we hear that there are a lot of zero tolerance policies mentioned everywhere, but we want those policies to be translated into actions, and accountability must be ensured at all levels. Back to you, Anna.
Definitely an important issue, and something that Women in Global Health has been working all of last year's on. So in terms of accountability on sexual exploitation, abuse, and harassment, what more needs to be done?
Yes, that's a really important question. And something that we have witnessed is leaders have been turning a blind eye on the problem of sexual exploitation, abuse, and harassment in the health sector. And our recent report on the Health 2 has showcased the depths of the problem through the lived experience of the female health workers. And as I mentioned earlier, this zero tolerance must be implemented, and swift action must be done against leaders who tolerate it, because we seem to tolerate these actions and we're not acting on the reports, and we are very much lengthy and delaying the justice we need to serve. So that all stakeholders, including governments, multilateral agencies, global health organizations, civil society organizations like ourselves, and professional associations to work together and share the responsibility to eliminate it.
Definitely all points to keep an eye out. We will be reporting on how this issues turn out at the end of the executive board. So stay tuned on our social media platforms to know more about it. And I have one more question for Dr. Kalkidan. So you're also the point person for universal health coverage within the policy team of Women in Global Health. And we know the political declaration of 2019 included strong commitments on gender equality. Are you satisfied that these commitments are being delivered? And what are the challenges that we're currently facing, and what can be done at the executive board level?
Yeah. No, we're not generally satisfied, and we don't believe enough is being done on this topic. But when you look at it in general, UHC progress is not on track, and especially since the world has moved further away from the target sets, including the commitments made on gender equality. For example, sexual and reproductive health services have been deprioritized and they have been removed from essential service list. Policies on women's health and rights have been overturned, and women are still excluded from decision-making roles despite their majority of representation. And however, they continue to deliver the work while men are leading it. So we need stronger commitment with accountability to implement them on time. So in 2019, there has been a lot of commitments and a strong member state involvement in the process. But what we want this year is we want a stronger commitment, and not only the commitment, there should be an implementation of the progress, and implementing the commitment is very much critical, and we want at least to keep that momentum and to keep that commitment in the upcoming high-level meeting. And we want to remind the member states who will be participating during the EB to ensure that is included.
Oh, thank you very much for this. It has been very, very good to know everything that we're looking out for. And for everyone watching us, stay tuned for more information to come. If you're watching this, you probably already read our newsletter about our policy priorities, but you can go into our webpage and find that as well if you haven't. And in the 2 coming weeks, we will be updating you on the process of the things we're keeping an eye out during the executive board. I thank both Becca and Kalkidan for being here with us today. And well, I hope the best of luck during the executive board. Becca is going to be directly in Geneva, and Kalkidan is going to be part of the virtual delegation. So we will all be involved in the process. So thank you to everyone who joined us, and goodbye.
Thank you. Bye-bye.